Today, I'm going to walk through the new phases of North Carolina's vaccine plan. Based on new federal recommendations that were just issued last week by the CDC Prevention's Advisory Committee on Immunization Practices, or ACIP, we have updated and simplified the state's vaccination prioritization plan. First, I just want to share some important information about vaccines in general. We've been very fortunate that scientists had a head start. The vaccines that are now available were built upon years of work in developing vaccines for similar viruses. All vaccines are rigorously tested for safety and effectiveness, and more than 70,000 people volunteered in clinical trials right here in North Carolina as well for the two vaccines now available to make sure they were safe and work to prevent COVID-19. To date, both vaccines that are currently available are 95% effective in preventing COVID-19. There were no serious safety concerns in the clinical trials with either vaccine. You could have temporary reactions like a sore arm or headache or feel tired and achy for a day or two, but you cannot get COVID-19 from the vaccine. Vaccines will be available to everyone, but currently supplies are limited and will continue to be limited for the next few months. Therefore, states must make vaccines available in phases. You'll see as I go through the phases that everyone has a spot to take their shot. To save lives and slow the spread of COVID-19, the first phases focus on protecting healthcare workers caring for patients with COVID-19, protecting people who are at the highest risk of being hospitalized or dying, and protecting those at highest risk of exposure to COVID-19. So right now, we're currently in that first phase, phase 1A. Most of our hospitals received their first shipment of vaccine less than 2 weeks ago. Local health departments started receiving vaccine dosage just last week, a few days just before Christmas. Together, they are vaccinating healthcare workers caring for and working directly with patients with COVID-19, as well as those giving vaccines. The early data suggests that there is still work to be done to be sure that vaccines are administered equitably. Understandably, communities who have faced long-standing and continuing racial and ethnic injustice in our healthcare system may feel greater distrust towards vaccines. We are partnering with trusted community leaders and organizations to provide accurate information to all North Carolinians and also with our vaccine providers to ensure equitable access to vaccines. Long-term care residents and staff are also being vaccinated right now. The federal government is overseeing that long-term care vaccination through a partnership with Walgreens and CVS. This effort began on Monday, and data is not yet included in our vaccine dashboard. We anticipate moving to the next phase, phase 1B, in early January. Currently, there is not enough vaccine for everyone in phase 1B to be vaccinated at the same time. To best manage vaccine availability, we will open phase 1B in groups. We will add additional groups from phase 1B over the month of January, one at a time. Vaccines will first open to Group 1, which is anyone 75 years or older, regardless of medical condition or living situation. In Group 2, it's our healthcare workers and frontline essential workers who are 50 years or older. They'll be added in next. This group will be followed by Group 3, which are healthcare and other frontline workers of any age. Just like the previous phase, the groups in phase 2 will begin one at a time. Vaccines in phase 2 will open first to anyone ages 65 through 74, regardless of medical condition or living situation. Next, will come to anyone 16 to 64 with a medical condition that increases the risk of severe disease from COVID. They'll be followed by anyone who's incarcerated or in a group setting that has not already been vaccinated because they're a part of an earlier phase or group due to their age, medical condition, or job function. Then vaccines will open to other essential workers as defined by the CDC who have not yet been vaccinated. In phase 3, college, university, and high school students 16 or older will be vaccinated. Younger children will be vaccinated when the vaccine is approved for them. It is not currently. And in phase 4, that's